The first segment of the Hot 7 Nightly News is brought to you by Flow.
Tonight, a COVID-19 positive patient has died in home isolation. Players in the tourism industry brace for a harsh winter period as the COVID-19 positivity rate fails to descend, and calls for mass sensitization and education as cannabis laws are amended. The details of these stories and more coming up.
This is the Hot 7 Nightly News with Lovelace and Amy Joseph.
Good night. It is Thursday, the 2nd of September 2021. Welcome to the Hot 7 TV Nightly News. I'm Lovely St. Amy Joseph. Thank you for joining us. Police and health officials are investigating the death of a 28-year-old woman who died at her home Thursday morning. According to reports, a mother and her two daughters were in COVID isolation at their home in Black Bay, Vieux Fort. The St. Lucia Fire Service responded to the call.
A distress call came to the Vieux Fort Fire Station requesting assistance for two female individuals who tested positive for COVID-19 in Black Bay, Vieux Fort at 8:12 a.m. on Thursday, September 2nd. The responding emergency crew found one of the patients unresponsive and void of all vital signs. She was later pronounced dead on the scene by a medical practitioner. The other patient was provided rapid emergency transportation to the Vieux Fort Respiratory Clinic, where she was handed over in a stable condition for further medical care. The scene was left in the care of the police.
That was Fire Service spokesperson Stacey Joseph. Will the measures being promised by the Health Minister to strengthen the healthcare system be enough to alleviate the burden on healthcare workers? That's the question being asked of the Secretary of the St. Lucia Medical and Dental Association. Dr. Indel Niles was in the hot seat on Wednesday evening, where he spoke of the mounting workload of those employed within the health sector. Members of the association are waiting to see if the most recent COVID-19 measures will slow the spread before jumping to conclusions about the plans being promised by the Health Minister.
Over the last 19 months, healthcare workers have been stretched thin, having to deal with their regular duties coupled with the novel coronavirus. With multiple COVID-19 waves and periods where the country has had to deal with thousands of active cases at a time, it is clear that healthcare workers are burnt out. The incoming Minister for Health, Wellness and Elderly Affairs, Moses Jabatis, has committed to strengthening the island's healthcare systems, as well as ensuring that those who are touched by the COVID-19 virus can recover as comfortably as possible. But moves by the Health Minister to do so are being closely watched by the St. Lucia Medical and Dental Association, as alluded to by the Secretary, Dr. Indel Niles.
The newly appointed Minister for Health said in the House yesterday that there will be assistance in the hospital. Will that be enough, or if you had to advise, what would be ideal for doctors, medical professionals working in this pandemic? He
urged all physicians to give of their time during this very critical period.
I know as an association we have tapped into all of our general membership, especially those physicians who work in a private capacity, asking that during this period of time everybody more or less offer, whether it be a day, a few days, or even up to a week of your services to the public healthcare system in any capacity necessary, whether it be in that of contact tracing, in the primary healthcare, in the different clinics, etc., or even at Victoria Hospital. Because we have recognized that right now it needs to be a case where everybody plays their part, not just a few, not just standing up from a distance and giving advice without actually being physically active where it comes to the pandemic itself.
According to the Health Minister, over the last 3 weeks, government's priority has been to provide much-needed additional support to the arms of the public health system, which manage COVID-19 directly. For the Hot 7 News, Nisha Charles reporting.
The spike in COVID-19 cases is not only affecting the health of St. Lucia, but also the tourism industry. Independent Senator and CEO of the St. Lucia Hospitality and Tourism Association, Noorani Aziz, says that if St. Lucia continues on this path of a consistent rise in COVID-19 cases, it will undoubtedly harm the tourism sector. Aziz says that difficult decisions will have to be made to curtail the spread of the virus.
The winter season is usually touted as a peak season for tourism, as it is the time of year where St. Lucia anticipates an increased number of visitors on the island. The winter season is extremely beneficial to St. Lucia's economy, as the increased number of visitors generates more revenue for the island. Unfortunately, due to the steep and consistent rise in COVID-19 cases, the tourism sector might be in jeopardy. Recently, the Center for Disease Control and Prevention, CDC, issued a Level 4 travel health notice for St. Lucia due to COVID-19, indicating a very high level of COVID-19 in the country. What does a Level 4 travel notice mean? As per CDC guidelines, tourists are to avoid travel to St. Lucia. This is an obvious cause for concern which can have adverse effects on the tourism sector. Independent Senator and CEO of St. Lucia Hospitality and Tourism Association, Nurani Aziz, says that the negative implications of the increase in COVID-19 cases is already manifesting.
As of the end of July, we were pretty comfortable that a very low number of guests departing the destination were diagnosed with COVID. We understand that for August we have seen an increase in this number. That is quite concerning. The impact of the rise in cases within the general population is also of great increase, and we are also noticing cancellations starting to happen. And so a number of properties have been chiming in with cancellations that are in significant numbers, dollar values. And so we know for a fact that if we are to continue along this current trend, it is going to be a very dismal winter.
Aziz re-emphasizes that the travel advisory could certainly prove to be disastrous for the economy. Aziz also notes that cancellations have already begun.
The advisory is predicated on the fact that numbers are climbing locally, and it is not something that is unusual, but the impact is severe. The economic cost to us is very, very significant, and could number into the millions of dollars in cancellations if we're not careful. Already, as I indicated, we are seeing a very uncomfortable number of cancellations taking place. Cancellations among our smaller properties is something that we just don't have the capacity to tolerate right now, because business volumes, once they start to fall, it means that is a curtailment of revenue going to suppliers, and it means potential layoffs again.
He says that at this critical juncture, alternate and more stringent strategies may have to be used to curtail the spread of the virus.
It is very important for us to do everything we have to do, and that includes taking some more difficult decisions and making some deeper sacrifices in order to get the numbers down. It also means that we have got to amend our behavior, and we have got to watch our own private and individual practices to curtail the spread of the virus.
The SLHTA CEO says that this is the harsh reality that St. Lucia faces right now, and it is each and everyone's responsibility to act accordingly. Reporting for the Hot 7 Nightly News, I am Karim Nelson.
You're watching the Hot 7 TV Nightly News. Stay with us, still to come. Government will stand by its promise of inclusivity. That's according to a government senator. An opposition senator calls for mass sensitization and education as cannabis laws are amended. And St. Lucia receives its third batch of the AstraZeneca COVID-19 vaccine. That and more after the break.
The first segment of the Hot 7 Nightly News was brought to you by Flow.